going to be talking about the exciting opportunities for hair follicle tissue banking. Let's go. Okay, so the hair follicle needs no introduction to you all, but I will give a brief overview because it's a very exciting miniature organ, as many people consider it. It's quite a complex miniature organ that has the potential, or it completely regenerates every hair cycle, which makes it unique within the human body. And it contains around 20 different cells from different parts of from embryogenesis. It's derived from different regions, so it's very diverse and contains very diverse range of cells. And what makes it really great for the regenerative medicine field is how easily accessible it is and how numerous these hair follicles are. So you may also have heard of different types of tissue banking before, and there are a few different options available at the moment. Probably the most commonly used form of tissue banking is embryo banking for IVF, as well as egg and sperm banking for prolonging fertility. And there's also the opportunity to bank cord blood and placental tissue at birth for your children. And the benefits of doing that is you bank these stem cells that are really numerous within those tissues, and they are matched with the tissue of your child. So that reduces the chance of rejection when using them for a treatment. However, that can only be done at birth, and if you don't do it then, you've kind of missed that boat. So hair follicle banking, it represents an adult form of tissue banking, and you have these regenerative cells within the hair follicle. So how do we cryopreserve the tissue? So there's numerous ways of doing this, but the way in which we do it with the hair follicle tissue itself is that we take whole hair follicles that can be taken via individual FUE or from strip surgeries where they're chopped into individual units, and that's taken from occipital scalp, so DHT insensitive hairs. And those follicles are placed in a transport solution, in our case hypothermosol, and that maintains the viability of the tissue. And at this point, it's shipped to the clinic in Manchester, and it's got to be kept cool at all times. And then we use a control rate freezer to bring the temperature of the tissue down by 2 degrees every minute. And that ensures the cells don't form ice crystals within them, and therefore the cells don't burst. So the viability of the cells is maintained throughout this process. And once they reach minus 80 degrees Celsius, they're transported on dry ice to an HTA licensed tissue bank, where they can be kept indefinitely in liquid nitrogen at minus 196 degrees Celsius. And that's a temperature where it just freezes biological processes. And so they can be stored potentially indefinitely. And an important thing to note is that the follicles that we bank remain the property of the patient at all times. So we bank in different tubes so that, if a patient wants to take one to use for one thing and then another thing, they can do that. It's open to the patient as to what they do with their follicles. Okay, so back to the hair follicle and all the different cell types within it. That's the dermal papilla cells, which are our favorite. But also these other dermal papilla cells and the other cells, they can be used for non-hair applications as well. So hair follicle cells have the potential to treat other diseases, ailments, as well as hair applications. So, for example, people are taking the stem cells from within hair follicles and looking at using them to treat limbal stem cell deficiency. So these are stem cells that are found around the cornea of the eye. And when they're deficient, your cornea is impaired and your eyesight reduced. So using follicle stem cells, they're looking at a way to regenerate those corneas and give people better eyesight. In addition, hair follicles have melanocytes that produce pigment, and they're a really good source of these melanocytes. So they're being looked at for treatment for vitiligo, where the pigment in the skin is reduced because of autoimmunity destroying those melanocytes, basically. So they're being looked at for that as well. The dermal fibroblasts, so the dermal sheath cells, the dermal papilla cells, they produce large amounts of collagen, and so they're being looked at for treating tendon issues, so being able to regenerate tendon tissue, which are highly collagenous. And finally, the stem cells within follicles are being looked at to repair nerve damage, which is really exciting. Next, I'm just going to introduce an exciting opportunity for people that want to know more about this and possibly get involved. So this whole follicle banking process, it is another option for patients. So I don't know how many of you have people come in who are in the early stages and they're concerned about it, but they can't really do a lot. Maybe they can go on minoxidil, finasteride. It's another option for these people who want to do something and be proactive about their hair loss. It allows anybody getting involved to be part of a growing and reputable international network of some of the best names in hair loss. And so what we're proposing is a hair loss specialist referral scheme whereby those in touch with patients get some training from ourselves in order to put this forward to patients as an option, and then refer to a surgical clinic to be able to take those samples. And really, I suppose the most important thing is that our shared mission is to help patients at the end of the day. So we're on a mission to get this into the clinic, and in order to do so, we require the help of everybody, really. So to gain the exposure needed to then gain the funding to get into the clinic, and also the patient base in order to create the the people who are going to actually use the treatments. So the more people that get involved, the quicker we can make it into a treatment, the quicker we can help patients, basically. So something that we are proposing as well is an open event on the 21st of March in order to talk more about getting involved in a referral scheme. Open to everybody, but it would be a UK-based referral scheme to begin with, but obviously anyone is welcome to learn more about it if you want to come along on the 21st of March. So I'd just like to thank everybody for their help in getting to where we are. So obviously the members of HairClone, as well as scientific advisors who have been really great. And of course, the clinics and follicle banking patients and the investors who have got us to this point. If you're interested in any further reading, there's a paper at the bottom there, and it's talking about the hair follicle and how it's an underutilized source of cells for regenerative medicine. And it covers quite a lot of the topics I spoke about today. And if you want to learn any more as well, please feel free to contact me or the company down here, or follow us on Instagram. And I thank you for your time.